Hello everyone, welcome to Grey Matter, your one stop to all your exam preparation needs. Today we are going to talk about contraceptions, which is a very important topic related to the UKMLA. Many of you guys found it tricky, but we're going to simplify it. We're going to make sure you know the right things according to the UKMLA. You don't overexert yourself with irrelevant information, and you know exactly the information that is required of you for the UKMLA. So when a patient comes to you, a patient is going to come to you demanding contraception, or they want to know about contraception. So what you are going to do is you're going to acknowledge the patient, you're going to take a brief history from the patient. You want to know what is the need of contraception for the patient. Does the patient need emergency contraception? Does the patient need long-term contraception? So according to UKMLA, there are two kinds. There are emergency contraception and there is long-term contraception. So in emergency contraception there are two kinds. There is levonorgestrel, and this you have to take within 72 hours of the unprotected sex, and the second one is 11, and this you have to take within 5 days of unprotected sex. The third one is intrauterine device, which you can take within 5 days of unprotected sex or 5 days of ovulation. But IUD usually not preferred method in case of emergency contraception. And in case of long-term contraception, there are different options such as combined oral contraceptive pills, the progesterone only pills, various injections, various implants, intrauterine system, and finally intrauterine device. Before we move ahead, you need to know that in case of contraceptions, as long as the contraceptions are associated, the king of contraception, you can say the king of contraception, now that are condoms. Now, why are condoms the king of contraception? Because not only do they provide protection from having a baby, they also provide protection against STIs. They are the only method that protect against the STIs. That's why that's the king of contraception. So now we can move ahead. So basically the long-term contraception that we have talked about, you can divide those in the form of tablets, injections, or implants. So when you're telling the patient, you can say that the long-term contraceptive methods, there are three kind of methods. There are tablets, there are injections, and there are implants. And then you can say definitely we can help you if is there any specific method that you have in mind, and then the patient will tell you if they have a specific method in mind. So IUDs, I talked to you about IUD. IUD is not preferred in case of an emergency contraception, because the intrauterine device, they require a special nurse, and so we don't really prescribe it as an emergency contraception, because not always the nurse is not always available at the specific centers or where the patient is coming from. So that's why that is not a preferable method for the emergency contraception. So when you're prescribing the emergency contraception, you need to tell people few things. That is, take the pill as soon as possible. We have already discussed about the specific time period in which the medicines have to be taken. And after taking the pill, if the patient vomits within 2 hours of taking the pill, you need to take another. Okay, So that you have to counsel the patient that if after taking the contraceptive pill, the emergency contraceptive pill, and they vomit within 2 hours, they need to take another pill. And then you need to safety net that there she can suffer from late periods, and she also might get pregnant, because the efficacy is not always 100%. So she might get pregnant also, and she might get late periods due to the effect of the emergency contraception. This is a safety net that you need to counsel the patient when you're prescribing them an emergency contraceptive pill. And after giving her the telling her about the emergency contraceptive pill, after offering her the emergency contraceptive pill, offer her an appointment for long-term contraception. So in the future, she has a proper system in place to protect her from unplanned pregnancy. And you need to tell her that this pill does not protect against STI, which is very essential. So you need to tell her about the STIs, and you need to counsel her about the use of condoms. So that's why we need to say that condoms are the king of contraception. Now, as we are talking about the long-term contraception, if you need to counsel the patient regarding the long-term contraception, you say it is divided into pills. Now, there are two pills: the combined oral contraceptive pills, and then there are progesterone only pills. And regarding this, you counsel that as soon as patient stops taking the pill, they can get pregnant again. So they need to continuously take the pills. Whenever they stop, they have a risk of getting pregnant again. Now, in case of injections, if you stop taking injections, it will take around 3 months to get pregnant again. And in case of implants, it takes 3 years to get pregnant again. And in case of intrauterine system or intrauterine device, it takes 5 years to get pregnant again. So that is a really, really long time, but you need to counsel the patient regarding the time period after which they can get pregnant again. Now, in case of intrauterine device, you can say it provides an instant protection. As soon as the device is implanted, they can start having unprotected sex and they'll have instant protection. But in case of progesterone only pills, you need to use condoms for 2 days, as it takes 48 hours for the progesterone only pills to start working. So you need to tell them to use condoms for those 2 days, because they can get pregnant in those 2 days. And for everything else, it takes approximately 7 days for it to work. So use condoms for 7 days. So as you can see, the topic is really not that difficult. If patient comes regarding the emergency pills, you need to tell them is either levonorgestrel, either LR1 within 48 hours, within 72 hours, 72 hours and within 5 days. And IUD, you can just not consider it emergency contraceptive pills. In case of long-term contraception, there are pills, there are implants, there are injections. So there are systems, so you need to tell which kind of system do they want. In case of pills, as soon as they stop taking the pills, they can get pregnant again. In case of injections, it takes 3 months to get pregnant again. In case of implants, it takes 3 years to get pregnant again. And in case of the systems or the device, it takes 5 years to get pregnant again. And the intrauterine device, it provides instant protection, whereas the progesterone only pills, it takes 2 days to work. So in those 2 days, use condoms. And in case of everything else, use condom for 7 days. Now we are going to talk about the pills contraindication. You need to rule out contraindications from the patient's history before prescribing them the pills. Now, the absolute contraindication, that the indications in which it is absolutely prohibited to use these pills. Migraine with aura, uncontrolled hypertension, smoking greater than 10 cigarettes, and her age is greater than 35. Current breast cancer, any history of blood clot, or 12 weeks after surgery. So these are the history that you need to take, absolute contraindications for the use of pills. So these questions you need to ask and make sure none of it is positive before prescribing them the emergency contraceptive pills. And you need to, apart from these questions, you need to ask about her periods, you need to ask about her sexual history, you need to talk about the pill,